to see you, Nicola. Tell us more about the report by UNICEF and the WHO.
Well, Maria, as you said there, actually, their main concerns is the fact that new mums, who obviously are anxious at the moment, are being told that infant formula, these breast milk substitutes, is safer than breastfeeding. And so there's three organisations who've combined together here. There's the WHO, there's UNICEF, and there's an organisation called the International Baby Food Action Network. And what they're saying is even worse is the fact that healthcare professionals, the people that new parents go to for advice on nutrition and how to best feed your baby, these are the ones who are being persuaded by the formula manufacturers to suggest that using formula is better than breast milk. And that's not true. UNICEF in particular is saying that although they accept health systems are stretched, healthcare workers are being moved to deal with COVID-19 patients, you can protect millions of babies if they are fed by breast milk. Some of the figures that they say is that breastfed babies are 14 times less likely to die than babies that are breastfed. And they also say that if a child is breastfed from 0 to 6 months, which they advise, and then if they augment that with food but continue breastfeeding until they're 2 years old, you can prevent obesity, you can prevent leukemia, and you can prevent diabetes in the children. And the mothers themselves are protected against ovarian cancer, against breast cancer, and themselves getting diabetes when they're older. So that's why they're really coming together saying that legislation about the promotion of breast substitutes needs to be tightened up. There is a code that was set up in 1981 against this, and they're saying that this code is even more relevant today than it was before. Now, I was speaking to a midwife this morning, and I asked her, I said, are mothers concerned about breastfeeding their baby, that they could pass on COVID-19? And she said, actually, no, it wasn't something that they had been worried about. But that's because here in the UK, there is very much an active policy encouraging breastfeeding. But the midwife I spoke to, she herself was really quite angry because she says this is outrageous if women are being given this misinformation and if they are told to not breastfeed but to switch to infant formula.
So amidst all this misinformation and confusion, Nicola, what is the advice for new mothers?
Well, the WHO says at the moment there is absolutely no evidence that's found the live COVID-19 virus in breast milk or in breast milk that's been expressed by a mother to give to a baby. So they're saying that even if you have confirmed or suspected COVID-19, continue to breastfeed your baby, to take certain precautions. Now, they say if you have access to a mask, and obviously in some countries that might not be possible, but if you have got access to a mask, to wear one when you are breastfeeding so you're not breathing over the baby, to wash your hands before you touch the baby, which is actually advice that all new mums are given anyway, to keep the surfaces clean. And they say they really want to emphasise that infant formula is not better, it's not protective against COVID-19, but that new mums should continue to breastfeed as long as they can. And obviously not every mother is able to do that, but if they can, that's the best thing for their baby.
Okay. Nicola Hill in London, thank you so much for that.